Hello, hi, welcome to my channel. Welcome back. This is Dr. Erica, pharmacist, pharmd, doctor of pharmacy. Thank you for joining me. Please visit my website, themillenniumpharmacy.com. Also, binge watch on all videos that I have. Don't forget, most importantly, subscribe to this channel, like and share as well. So this particular video, I'm going to talk about absorption. Absorption of a medication, oral consumption is what I mean. That is oral consumption of tablets, capsules, liquids, lozenges, all of those those submucous as well, those that go under the tongue to melt and then absorb through the actual bloodstream. I'm not talking about those. I'm talking about the ones medications that would go down through the esophagus and then down through the stomach lining and intestine lining. So when I say oral, again, I'm talking about tablets that you swallow and capsules that you swallow and also liquids that you swallow as well. So this particular video, the terminology and medical terms that are utilized are more so for medical students and pharmacy students, just because these patients may not understand the medical terms. So do be aware. So absorption is the rate and extent of the medication. Once the medication is consumed, it meets the stomach lining. The stomach lining has a pH balance. It also has proteins that help with absorption in the intestines as well. Now, the absorption rate is determined by how well this medication is interacting with other medications, how well the medication may be interacting with the food content of the stomach. Maybe the person recently ate a meal or ate a fast food meal versus a healthy vegan meal. It all determines the rate of absorption and the extent. Not all of medication is absorbed. Some medication might go straight through and excreted through the feces. So do be mindful of that. Now, some medications do, as a percentage, is absorbed, but only as a percentage. And that is considered the extent to where it is absorbed. So the rate, again, is determined by how fast the medication is received through the stomach lining, through proteins that allow the medications to enter into the bloodstream, and also by the consumption of food products, other drugs that might have been taken along with a particular medication. All of those play an effect of the rate and extent of absorption. So do be mindful of that. Now, there are some extended release medications and some immediate release medications. Immediate release medications act more fastly because they're not, they don't have that particular enteric coating or special coating that allows the medication to be disassociated or disintegrated. Now, extended rate medications that have that covering are medications that must work over time in the intestines for absorption to occur at a slower rate. So do be mindful of that. Now, some medications will let you know ahead of time, or some indications will let you know ahead of time to take a medication on an empty stomach or with a meal. For example, iron. Iron is an extended release form and it's an immediate release form. The immediate release form is best absorbed on a full stomach, and then the extended release form is best absorbed on an empty stomach. So that lets you know that the medication in different forms, whether immediate or enteric coated, works in differently in different situations. So do we be mindful of that when taking a medication. Now, sometimes the medication might be taken best in the morning or might be taken best in the evening because of different other factors that I'll go over in another video. So thank you for joining me on the absorption rate and extension, which is part of pharmacokinetics. I'm happy to share that with our medical students and pharmacy students alike. Please like, share, and subscribe. Thank you for joining me. Take care. Bye-bye.